It's now my pleasure to introduce Mike Eisenberg. We've talked during the week about the Consensus Project and the various projects, and we've talked about the fact that we are a data-driven organization. We haven't talked that much about the people who help gather, put together, make sense of, and put out that data. And we have an incredible shop, if you will, down in Austin, Texas, made up of 4 folks who really do our data collection, our data analysis, our work, and give us words to be able to talk to others about the concepts and the projects that we do. One of the folks that works down there is this gentleman right here, Mike Eisenberg, who is the research manager down in Austin for the Council of State Governments Justice Center. And I'll briefly read you a few lines of his bio. Mr. Eisenberg manages the logistics and methodology of key research and evaluation projects in the areas of parole, probation, and substance abuse and mental health treatment programs here at the Council of State Governments Justice Center. For the past 25 years, he's directed complex research projects and has written analytical reports for policymakers and correctional administrators for the state of Texas, including work for the Criminal Justice Policy Council, Board of Pardons and Paroles, and Department of Criminal Justice Parole Division. He's evaluated substance abuse treatment, mentally ill offender diversion programs, faith-based correctional programs, sex offender treatment, and employment and correctional education programs. So, ladies and gentlemen, Mike Eisenberg.
So we'll go over 3 main areas: the role of data in decision making, the minimum level of effort for data that you should be making, and then the data and impact on sustainability. So the first area that we're looking at is, are data relevant to decision making? And I'm sure everybody has been asked the question, does your program work? It's a common question. It's a hard question. So one of the ways that you know your program is working is, do you have data to know if it's working? If you do, you can do an analysis to show that your program works. If it does, you got no problem. If you don't have the data to know, you're going to have some spinning efforts going on. If you can spin it good, using a testimonial from a powerful person or a poster case, and Tony uses poster case a lot as an example of somebody who did good, like my son was mentally ill and schizophrenic and bipolar, and he went to Bob's program and now he's not. Data is used at different levels in the system by decision makers, and they have their own uses for it. Elected officials can use data to make good policy. If it coincides that good policy is also good politics, it's a win-win for them. I can tell you every day, good politics clashes with good policy. We have a great example going on in Texas, where the good politics is, we're not going to raise taxes. We have essentially a $27 billion deficit, and our legislature to the man is saying, we're not going to raise taxes, we're not going to dip into our rainy day fund, we're going to spend the amount of money we expect to get. On the other hand, we had a very good policy that averted 17,000, a need to build 17,000 prison beds by instituting a rather large treatment program for probationers and parolees. And for the last 5 years, instead of going up, our prison population has gone down. And our debate right now is good politics going to clash with good policy? Are they going to have to cut those programs to keep their political promise not to raise taxes? I'm sorry. Then at the fiscal and grant manager and program administrators, data is important to determine if you have good performance or poor performance. And then, of course, for program recipients, it's really critical to know whether this thing is working for them. And so data is just one of many things that elected officials are using in determining whether your program is important to them. Interest groups. Does this problem fit your worldview? Do you believe in it to some extent? Would I get good press coverage? Tony's kind of a skeptic about everything, so we'll have this kind of stuff. And then they may look at the evidence and data to show whether this program works. And I just, I want to stop and say, most of this presentation, you all know. He's put it kind of in the context of things that you know, but you may forget. And so this is something that should be in the forefront, when you're doing your program and when you're trying to, sustain it over time. At the administrative level, there's more uses for the data. It helps you know whether your program is well managed, where you can count for your funds. And then again, one of the keys here that we're looking at is, does the data show that the program is effective, and is it cost effective for enough clients? And this is kind of a little subtle point here. Does this program have enough clients to be cost effective? So, you may have 10 clients and spend $1 million and, you're very successful. But, it's not really going to be cost effective. You could have just bought them a house and paid them a salary for the rest of their lives. And then at the program participant level, of course, it's critical that, your program participants are showing positive outcomes from your program. This is kind of a list of the usual challenges to document program performance. There's often a lack of analytical capabilities to identify your target population. There's not enough information to tell you what the flow is of clients into your program, if it's going to make sense. You find data systems or a lack of data systems that don't capture the key elements that you're looking at. Data systems don't talk across agencies. In the administrative level, there may be a lack of process evaluations to show that what you're doing is what you said you were going to do, and that has a relationship to the outcome of your program. Claims of confidentiality. There was a good session by one of our staff, Hallie Fader-Toe, on confidentiality and legal restrictions and HIPAA and all that stuff. And it was pretty interesting. It's very difficult to evaluate programs, and it begins with you have to agree on what the outcomes you want to use for your program, and then it's hard enough to get this grant, get your program up and running, provide services, and then they expect you to be a professional program evaluator. It's very difficult to get those kind of resources together. And then there's often the problems of, even if you have your outcomes, difficulty in presenting information, and of course there's always a little money for research. So now we're going to talk about the minimum level of effort for data. You need to have the identification of your population characteristics, how many males and females who you're serving, at least have tracking of basic aggregate counts. How many people did you serve? How many people were completed successful? And then this is a kind of an area, and we'll hit it a little later, that I'm not fond of, but it's very important, kind of a flow chart of your process. And then various documentation of efficiencies that you have for your program. And then, again, at outcomes, you have to agree on what your basic outcome measure is. I was involved in probably the largest drug treatment program Texas has ever had, the most expensive, and they had no definition of program completion. And it's very problematic to have a multi-million-dollar program and you can't say how many people completed this program. And then, and this is a very simple outline here, but I thought it was very concise on how you make a presentation. You define the problem that you're addressing, what your strategies are, how well those strategies were implemented, how many people were served, what were the outcomes. If you can do those basics, you're ahead of a lot of people, and it's very important in documenting the success of your program. So, again, this is stuff you know, but it's kind of interesting to see it all laid out, all the areas that you're addressing when you have a program crossing disciplines like justice and mental health. So he kind of laid out various areas that you'll be looking at in your evaluation and your data collection. And you're also dealing with a multitude of actors in the criminal justice and mental health communities. We're in our work at the Justice Center, we're always trying to be very inclusive in dealing with all the stakeholders that are involved. And it is hard. There are a lot of people, and when we leave somebody out, we hear from them. And they're not very happy about it. So we try to be very inclusive, and everybody plays a role in this process. So in trying to develop your outcome information, your process information, you need to identify where your sources of data are. If you can access computerized records, I come from, the 70s. Do any of you even know what a punch card is? Anybody ever see a punch card? Horrible stuff. It was bad memories. But you had to punch all your data on cards, and then if you were lucky enough to have access to a mainframe computer, you submit all your cards, and if you forget a period somewhere, you got to start all over 3 days later. Luckily, most things are computerized these days. Sometimes people don't know where that data is, and you should rely on all your previous actors in trying to identify where that information is. Sometimes it's not computerized. Sometimes it's maintained on paper records, and you'll have to access those. Then you get to the issue of who owns the data, and will they share it with you? Are you capturing the elements that you need for your program? How do you get that information? And is that data any good? And you should never assume that if you get some data, it's good, because it can be bad. There's bad data and there's good data, and we don't like the bad data. Now this is what I was talking about, mapping up your program. For me, I hate the exercise. It's too hard. I'm not good with those icons. I don't draw very well. But it's really a fascinating process to really learn how your system works, where your inputs come, where your outputs go. And it really will illuminate a lot of things for you once you do that. You'll find out where your gaps are and where you may need to make changes. So this is kind of an overview of how you might have a basic analytical picture of your program. So you list out your goals of the initiative, who that target population is for your initiative, what your program implementation strategies are, look at the number assessed for the program, referred and selected, conceptualization of the various service packages that you provide some basic numbers on the number served, contacts, duration of the intervention, then a description of intervention services, who completes, who drop out, have a comparison group. Comparison groups are really hard to find, but they're critical. I don't know, I'm having a lot of issues with the performance measurement tool, because one of the critical goals, one of the reasons that you're funded at all is that there's a belief that intervening in the lives of mentally ill offenders can reduce recidivism. And if you can't effectively measure recidivism and you don't know whether you have that measurement of recidivism is a change from previous behavior, then you just got a number out there. So right now in the performance measurement tool, it talks about reduction in recidivism, but it's only getting, and it's not a great calculation of what's the recidivism rate of this group. So if you end up finding that the recidivism rate of this group is 30% are arrested in 2 years, is that bad or good? If you don't have a comparison group of offenders or clients that look like them that didn't receive services and know what their recidivism rate is, you don't know if you've reduced recidivism. So it's important to do process, to know that you're actually doing what you say you're doing, that you're implementing the program you designed, that you believe will impact outcomes. So these are just some various output measures that people use, and also some efficiency measures. And then these are some examples of various outcome measures that have been used in the past, and If you've been to some seminars, this morning there'll be some seminars on also measuring outcomes for you. There's a good publication on our website at consensusproject.org that goes into a lot of different ways to measure your outcomes and services and delivery. So here's a couple of simple presentations. Here's the simple one. This says here's recidivism rate of participants, and this is a comparison group, and looks like we do twice as good with participants. Here's a more detailed presentation looking at change in emergency room visits and costs and outpatient visits and costs, showing that after participation in the program, the costs and visits have gone down in this particular study. And here's one you don't want to do. I still haven't figured out what it is or what it means. And the simpler, you know, even if you're familiar with what it is, you're going to be presenting it. You know, always know your audience. You're going to be presenting it to a lay audience in general, or politicians who won't really understand what you're talking about. So the simpler you can get, the better you are. So we're just sort of saying that data is really important in sustaining your project and in getting your piece of the pie. And if it does, it is affected, then a couple of years later, somebody else is going to come along and want your piece of the pie. And you have to demonstrate that you're the ones who deserve this piece of the pie. So in summary, there's kind of we went over the key role of data for various decision-making levels, the basic analytical components, and how the data is key to sustaining your project. And that's it. Thank you very much. Any